From the moment you make your decision with the IVF specialist that you're going to do IVF, the process begins. There are baseline blood tests for both the male and the female that need to be instituted, along with an ultrasound and also a semen analysis that need to be put in place to ensure that there is nothing that needs to be tweaked prior to starting an IVF cycle. Now, although the actual cycle itself starts on day 1 of your next menstrual cycle, there are a number of things that need to be put in place before starting. Approximately a week prior to your next period, you'll meet with the nursing staff and they will teach you how to use the medication, how to give yourself the injections, how to draw up the medication, and they'll also determine that there are no abnormally grown cysts on the ovaries that will impact negatively on your IVF cycle. On day 1 of your menstrual cycle, you will ring up the fertility centre to tell them that you have started. And it's really important that you take the advice step by step that the nursing staff give you. From approximately day 1, you'll start to give yourself injections. And the frequency and the amount is entirely dependent on the regime that the fertility specialist has designed specifically for you. Throughout the first part of your IVF cycle, you will have periodic blood tests and also ultrasounds to determine the growth of the follicles on the ovaries. You see, the intention of IVF is not just to grow one dominant follicle, but to grow up all of the follicles that contain eggs in that particular group in that month. That is called controlled ovarian hyperstimulation and is the basis for an IVF cycle. So after approximately a week and a half, where each of those follicles have grown from about 0.5 centimetre to about 2 centimetres, and the ovaries go from the size of walnuts up to about the size of your fists, at that point, your fertility specialist will decide to give you a trigger. And what that trigger injection does is mature all of the eggs inside those follicles to ensure that they're just ripe to enable IVF to occur. Now, approximately 36 hours after you've been given that trigger injection, you then come into hospital for a transvaginal oocyte aspiration, or otherwise known as an egg pickup. Now, different units are different, but in my unit, we do an egg pickup under a general anaesthetic, and this is done transvaginally using ultrasound guidance. So you're completely asleep for the process. After you wake up from the egg collection, you will have a little bit of abdominal discomfort and may have a small amount of vaginal bleeding, but it's quite a quick process, somewhere between 15 and 30 minutes, completely dependent on how many follicles that you have growing. On the same day that you come in for your egg pickup, your partner produces a fresh sperm sample. Alternatively, if that has not been possible, then frozen sperm can also be used. Once the eggs have been collected, they are taken to the laboratory, and that is where the IVF or in vitro fertilization process happens. So each individual egg is put into a petri dish and surrounded by approximately 100,000 sperm. And the process of fertilization that naturally occurs happens within the petri dish. And that creates the zygote or the fertilized egg. Now, not all eggs will fertilize. We expect that approximately 75% of eggs will fertilize. Each of those fertilized eggs is then placed into an incubator and left for a number of days. In our laboratory, we grow all of our embryos up to day 5, which is the blastocyst, as evidence has suggested to us that produces the best pregnancy rates. Now, not all of those embryos are going to make it to day 5. A substantial number of those embryos will grind to a halt at around about day 3, when the embryonic genome kicks in, its own natural entity kicks in. So if you start with a cohort of approximately 10 eggs, it's not unusual to end up with 2 to 3 embryos on day 5. That's a very expected result. On day 5, those embryos are examined under a microscope. We look for how many cells there are, what the inner cell mass looks like, and we make a judgment based on scientific evidence as to the quality or the grading of those embryos. And the best graded embryo is transferred back. So you will come back into the fertility centre on day 5 after your egg pickup, and we will take the best looking embryo, and under ultrasound guidance we will transfer that back into the womb, not unlike having a pap smear under ultrasound guidance. Those additional embryos that may be left behind are then frozen for future use. Approximately 2 weeks after you've had your embryo transfer, you will then undergo a pregnancy test, which is a blood test to determine if you're pregnant or not. Now, not 100% of the time will you be pregnant. It depends on a number of different factors as to your chance of pregnancy success. If you're not pregnant, then we suggest you have a month off to allow your ovaries to settle down again. And then we would take one of those frozen embryos out of the freezer and then put it in the womb in a frozen embryo transfer cycle. If you are pregnant, that's fantastic. Those embryos that are in the freezer can remain there for many years to be used in the future to add to your family.